Ric José González Rothi is a very good friend. He's a dear friend. We met walking our dogs and ended up like talking for 2 hours. And his contribution to humanity at work is called Beyond an Apple a Day. He has a resume as long as your arm and just really has excellent insight into the medical profession in general, and especially what's been happening recently. His piece is just a journey through a whole bunch of scenarios and stories and experiences and suggestions, and it's well worth a read, I have to tell you. So I want to share a short bit of it. It's a scenario called Scenario Number 5. Why don't they use people like me? Each year, several thousand physicians and nurses retire from active full-time practice. They're usually experienced clinicians with a lifetime of knowledge. Most of us retire, but are still fairly healthy and competent in our profession and skills. During the pandemic, many states waived the state license requirements so that physicians like myself, who actively maintain their medical license in one state, would be able to volunteer their services in another location without obstacle, as it was considered a state of emergency. This is a step in the right direction. It has allowed me to administer many COVID vaccines through various health groups. Many of us would still like to give back to society and share our skills, particularly with folks who are economically, physically, and geographically disadvantaged. Most would volunteer their time gratis. I've tried to do this on multiple occasions, but have hesitated. I'm bilingual in English and Spanish, and I'm a trained general internist and pulmonary specialist with 40 years of experience at the bedside. I have something to offer. What most of us struggle with in trying to volunteer for the undeserved is that few, if any, of the places we would be able to offer our services would grant us immunity or a cap from medical liability against lawsuits. If policy makers would play what Rick calls the GLAD game, a system could be set up on a state basis or nationwide. Call it the Retired National Health Service Corps, and allow that it would cover the 8,000 to 47,000, depending upon state and location, that it would cost a retired doctor to purchase malpractice coverage to do primary care in an outpatient setting in exchange for agreeing to volunteer their services to patients in underserved areas at no charge for 1 or 2 half days a week. Even better, the locality could even sweeten the pie for those physicians and nurses by allowing them to forego or underwrite the expense of renewal of their license and continuing medical education if they do gratis volunteer work. This makes perfectly good sense. And I think that he is exactly right. So stop by, read Humanity at Work, please, and especially pay attention to Rick because he's a good writer and has stuff to say. Thank you.